Today, we're talking about two common health conditions. They're more close connected than most people realize: diabetes and gum disease. If you live with diabetes, your risk of developing gum disease, also known as periodontal disease, is significantly higher. Why? Because elevated blood sugar levels can impair your body's ability to fight over the infections, including those that affect your gums. But the connection goes both ways. Gum disease doesn't just thrive on people with diabetes. It can also make it harder to control blood sugar levels. This creates a cycle that one condition works worse than the other. What are the warning signs of gum disease with people with diabetes? Red, swollen, bleeding gums, persistent bad breath, gum recession, and in more advanced case, even tooth loss. For patients with diabetes, controlling gum disease isn't just about maintaining a healthy smile. It's a vital part of managing the disease itself. That's why regular professional dental care is so important with these patients. Thorough cleanings and periodontal maintenance and early intervention can make a big difference in your diabetes control. Taking a proactive approach on your gum health can lead to better diabetes control and your overall health. Taking a proactive approach to gum health can lead to better diabetes control and overall wellness. If you have diabetes or suspect it, you may be dealing with gum disease. Don't wait. Contact your periodontist.